My name is Dr. Larry Jones. I am a retired pediatrician and a board member of NAMI Charlotte.
Absolutely. And what do you do at NAMI Charlotte that's so special as it relates to the youth?
One of the things that we've really are launching is a peer support group for families. We call it Bridges for Parents to Adolescents, and it's particularly for troubled teens and children who are having difficulty based upon the COVID-19 experience, as well as children who may have underlying mental illnesses, anything from ADHD to anxiety and depression.
You talk about anxiety and depression. I think now more than ever during this pandemic, it's running rampant
Yes.
amongst our youth. Can you talk about the psychological effects that depression, that stress, anxiety, long term, has on
Yes.
kids?
Well, first of all, I mean, in terms of the normal statistics with regards to children and adolescents, the incidence of mental health disease, our data is from like 2018. It's available on the CDC, cdc.org. And what we find is that there's significant percentages of children pre-COVID, because this data, like I said, is from 2018, most commonly ADHD, behavioral problems, and depression. Those are the three most commonly diagnosed things. 9.4% of children 2 to 17, which amounts to about 6.1 million children, have an ADHD diagnosis. About 7.4% of children 3 to 17 have a diagnosis of behavioral problems. And then children 3 to 17, 7.1% of those children are diagnosed with anxiety. So as you look at this, and this is pre-COVID, and all the statistics worldwide are basically showing that there's a significant increase in the incidence of any type of mental illness because of the worldwide disturbance of COVID, changing the entire environment on children. And children require a lot of socialization experience, just as adults do, but in a different way. When you remove that person-to-person contact, it frequently causes significant elevation of symptoms that already exist in children who have mental illness. And for those that don't, you see even opportunities for significant increases in anxiety. So the whole worldwide situation has really shown, one, some of the flaws in our healthcare system, particularly with regards to mental illness, and particularly among people who are already disadvantaged or at risk. So, given the numbers that I just provided, if you look at children and even adults that are at risk, those numbers actually increase and tend to be more severe because of poor access to mental health and to health care. Now, you asked about the long-term effects. The long-term effects affect most of the body systems, particularly the cardiovascular system, because prolonged stress has significant impact in terms of moving towards heart disease, moving towards diabetes, because one of the ways that people try to self-medicate or ameliorate some of the symptoms is by eating more and eating improper foods that don't promote good health. So that whole issue will tend towards diabetes, as well as other significant medical issues. So the social determinants of health also are the same social determinants for mental health. And those things are just beginning to be recognized and to be included in how Medicare, Medicaid, and those institutions, those access methods influence outcomes.
Yeah. Quick question. Yeah, you can bring her down. But first, before we get into that, and we're rolling, right?
Mhm.
Before we get into that, Talk about the good things that come out of this group. Just the blessing that comes with knowing that there are peers like you who may be struggling mentally, and that there are people like you who work with kids that are looking out for you. Talk about the benefits of this peer group.
The NAMI peer group bridges for parents to adolescents, which is available on the NAMI.org, NAMICharlotte.org website under resources, and then go to support groups. This group, we've put together this opportunity for parents to be able to have a resource to actually discuss and talk about the issues they're having with their adolescents, and for them to share that information and understand that they're not alone. This will help them to deal with adolescents. They'll hear the experiences of other parents and how they've dealt with those issues with their children. And I'll serve as the subject matter expert for the group, but we have two experienced support group leaders who will be there to really, manage and to help with the discussion and the group dynamics. In groups such as NAMI are always looking for support and donations. Another organization that I work with is homeforme.org, which is a not-for-profit specifically for at-risk children who are in foster care, giving them the coaching, the mentoring, and the skills to be able to go forth once they have timed out of the foster care system, which is at 18. So those two organizations, again, are available here in Charlotte. They're seeking funds to continue their good work, and we hope that there'll be continued support in order for those organizations to continue their mission and their good work.
Absolutely. Now, can you talk about the effects of being in a global pandemic that's already hard on
Yes.
kids? Just the social isolation, the suicide attempts have gone up, skyrocketed almost.
Yeah.
And to add to that stress, now they're seeing in the headlines in the news and seeing on social media that guns are being brought. Can you talk about the effects that does have on kids?
Okay. With children and as well as with adults, I mean, the association with violence, the experience, the trauma from that can be lifelong. It produces post-traumatic stress disorder, which is the same entity that soldiers experience once they come back from war zones. Unfortunately, the public is not aware of this as a diagnosis in children, but there are a number of ways that this could occur. It could be based upon violence in the home, it could be based on opportunities, violence at school, bullying. All of those types of events will lead to that post-traumatic stress disorder in children. I mean, the symptoms that are seen can be anything from difficulty with nightmares, sleep problems. They can be just being upset over fairly mundane types of things. There can be withdrawal, there can be isolation. But parents just need to be aware and watching their children for these signs. So one of the ways to help minimize and to prevent PTSD is for parents to really have a regular daily time when they talk with their children. It could be around mealtime, just to give them the opportunity to download some of the things that they're experiencing, and listening with an open ear, not judgmental, hopefully without emotion, in order to solicit their true feelings. Because if we bring in judgment, they're going to be less likely to discuss it with parents. They'll discuss it with other people. So it's really, really important to just to be that ear, to be aware. So, guns in the school, if there's any incident where those guns are used, is going to be traumatic for any child. Similarly, for some children, just the idea that those guns are present, which is what we're seeing in the news now, may be a trigger for them to develop PTSD because of their anticipation. I mean, that they could be a target. that they could be one of the people whose friends are shot. So, and the potential anxiety, because, many school districts also have preparatory programs for potential school violence. That in itself could provoke some symptoms, but it becomes an issue of, which has the greater value, the protection of providing potential guidance in those situations, or leaving the children without any proper planning. So, those things have to be weighed, but I think that it's important for children to have the opportunity to discuss all of those issues with their parents, and parents can make input as well as have some impact on the school systems to put in the appropriate precautions.
Amen. Now, when it relates to triggers, I think just by scrolling on social media, sometimes that can be a trigger to young people.
Yes.
But also that trauma that comes with knowing, something may happen, like you said. It is lifelong. So what can parents do? What are some quick tips that you can give to our viewers who may be parents that say, you know what, I want to get therapy. I don't know what I should do. What are some tips, if they're therapy, if they're talking to their kids during dinner, if they're just going out for a walk? What do you have to say to the parents who are dealing with this right now?
Okay. For parents dealing with this right now, NAMI is a great source. All of the services are free. There are multiple support groups. There are opportunities to learn more about mental illness, to be more acutely aware of the symptoms. Parents who have any type of insurance, they can see a mental health provider. It could be a therapist. If medication is needed, a therapist would recommend seeing a psychiatrist in order to get medication. So those are the accesses. And most importantly, for folks who have limited funds, organizations such as federally qualified health centers offer those psychological services, that they are required to at least have a psychologist or some mental health provider available for their patients that need those services. So generally pretty well accessible for most people. But if things are not easily accessible, NAMI is another organization that can help to provide support and to provide some guidance.
Absolutely. Now, was there anything, Dr. Jones, that maybe I didn't touch on or that you wanted to add, you wanted to let our viewers know just about the subject at hand and just the effects of it?
I think we've covered pretty much everything. The most important thing with children and adolescents is for parents to be aware, to be, humble enough and have the proper aspects of observation to not assume that it can happen to their child. It can happen to any child in any circumstances, regardless of the socioeconomic situation. So be aware of a change in mood, be aware of withdrawal, isolation. Those are key symptoms in children who are having either increased stress, depression, anxiety. Those subtle, but sometimes can be fairly quick changes should be a warning for parents to seek help with the primary care physician or the pediatrician, and to specifically to mental health providers.